This new guideline contains updated strategies and tools to help your team improve patient safety and staff safety related to moving, heavy equipment, related to ergonomic challenges in the operating room, and daily activities that put our staff and our patients at risk.
Hi, I'm Erin Kyle. I'm the editor-in-chief of the AORN Guidelines for Perioperative Practice.
And I'm Emily Jones. I am a senior perioperative practice specialist with the AORN nursing practice team.
Sounds like a really significant update to this guideline, and it sounds like all of these updates will have a tremendous impact on perioperative practice. So how do you think this guideline will actually change perioperative practice?
I feel that this guideline reinforces much of what has already been known for many years, that perioperative nurses have a high risk for musculoskeletal injury related to transferring patients, moving, repositioning patients, moving equipment and supplies, and during prolonged standing at the sterile field or during manual lifting tasks. The updated literature really provides evidence that continues to support the recommendations in this guideline.
Nice. So what resources are available to help perioperative teams implement the updated guideline recommendations?
In this guideline, we have provided several updates to the ergonomic tools. So these are useful tools that perioperative teams should reference before performing high-risk ergonomic tasks in the operating room. And these tools include information on situations such as when to implement assistive devices during moving and repositioning patients, the risk levels associated with various lifting tasks that we perform daily in the perioperative setting, and solutions to reduce physical stress during activities such as prolonged standing, manual tissue retraction, or when we're involved in patient skin prep.
Awesome. It sounds like the ergonomic tools really are fundamental in this guideline to helping teams identify risk and strategies to respond to those. So it's wonderful that those ergonomic tools remain in the guideline and that they have been updated with a little bit of new information. Any thoughts about what would be the most challenging aspect to implement in this guideline?
One of the biggest challenges I feel in implementing this guideline might be in changing the culture related to how safe patient handling equipment is used in the perioperative environment. And we have an entire section related to the culture of safety and safe patient handling and movement.
Emily, what recommendations in this guideline are new or updated?
There are a few new recommendations I'd like to highlight in this guideline. They relate to the selection of patient lift equipment, optimal locations of patient handling and lifting equipment to optimize their use. Finally, a new recommendation related to securing tubes and drains before we move patients. I also want to highlight a new section in this guideline related to fall risk and mobility assessments to improve patient safety.
Well, I just have one final question for you, Emily, and it's a little on the personal side, and that is, can you recall a time in your own practice where this guideline and the guidance provided in it supported you and your team?
As having some background in education, I think that education is really the foundation for improving patient and staff safety. And in my personal experience, I've used the ergonomic tools in this guideline to teach new perioperative nurses and other team members. So I think that is an example of how this guideline and these tools could be used by teams to help improve not only staff safety, but also patient safety. How about you, Erin? Have you ever had a situation where you use this particular guideline in patient or staff safety?
Yes, in my history, I've been a perioperative leader, and I recall times that I've leaned heavily on this guideline for supporting teams with the resources that they need to have the tools that are required to be safe when moving patients in the perioperative setting. As you well know, patients come in many shapes and sizes, and we really need the tools to safely move them, safe for them, safe for teams, and those tools really need to be in the places where they're needed to be located for them to actually be useful in the fast-paced OR environment. So thank you for that. Yeah, I think that
absolutely. You mentioned too about leaders, and one other area I'm reminded about in this guideline is our section on design of the perioperative suite. So if you are a leader and you are involved in the construction phase, take a look at ways to improve safety utilizing the guideline. Perhaps you find ways to include lifting and moving equipment in the design phase.
Yeah, in those strategic locations, because some of this equipment some of it's small, some of it is larger, and you need storage to place these items where they will actually be useful for perioperative teams. Because we all well know that if it's not where you need it at the time that you need it, chances are you might not take the time to go after it, even if it's going to help you.
Absolutely.
So I think that you bring up a really important point, that this guideline isn't just for perioperative nurses on the front line. It's not just for leaders. It's not just for educators. This guideline really has something for everyone. It helps educators to deliver much needed knowledge to new perioperative team members. It also provides an excellent way for perioperative educators to have a framework for showing new perioperative team members, whether they're novice to the setting or they're experienced in the setting, where we keep the equipment in our place.
That's right. So hopefully everyone, like you said, can find something useful in this guideline.